Hello, my name is Ennis Baker, and I'm happy to have the opportunity to talk to you about a project in North Carolina that's called the Edicare project.
Hi, my name is Lauren Thomason, and I am one of 3 Edicare project coaches. And our role in the project is to coach those coaches who we've already trained into implementing the Edicare project into the early childhood educational systems that they're already a part of. The coaches who we coach range from infant toddler specialists to childcare health consultants and technical assistants. Those are coaches who help centers develop improvement plans to achieve or maintain higher quality classrooms. And this year we've started including family childcare home coaches. And so our role with this is to be able to help the coaches to start with them and really prioritize responsive relationships with the directors, the family childcare home professionals, and the classrooms that they're already coaching.
I mean, this has been a positive experience. Like I can't speak enough about like what I have gained from this. I think the biggest thing for me was this self-reflection and the digging deeper and learning and discovering more about myself and just that personal and professional growth that I've, you know, been experiencing through this whole process.
This is something that I'm going to take with me forever. I've been in childcare for a long time, and I think we've been doing it, just what we, heard, or we just been doing it because this is what we've been shown to do. But there is the right way of making this a very nurturing and safe environment for children if we take care of ourselves and we do what we're supposed to do.
So the Edicare project is about building a trauma and resilience-informed early childhood system. And that means that we want to have an impact on every child and adult that is a part of that system. That's going to include the teachers, the directors, the supervisors, the coaches, along with the children and families who are part of that system. So the goals of the Edicare project are to first support the well-being of early childhood educators. Because if we do not take care of this essential workforce, how can we expect them to take care of our children? Our second goal is to teach all adults the impacts of stress and trauma on our brains, on our bodies, on our relationships, and on our behaviors. And third, we want to promote strategies that are going to reduce stress and build resilience for adults and children alike. So if you look at this model, this gives you a picture of how Edicare works to reach these goals. And what I want to emphasize is at the very center of the image. What everything else is revolving around is start with you. Whoever you are, wherever you're placed in the system, start by taking care of yourself. Everything starts with taking care of ourselves because only when we are well can we take care of others. And that's true for every person in every level of the system. If we look out from that circle, we see identify and reduce stress. We don't want to increase doses of stress. We have enough of that. We need to think about how do we reduce the stress in our own lives and the lives of children and families. Next, we want to prioritize responsive relationships. How do we connect with one another? How do teachers connect with students, with directors, with families, with the community? How do we structure a calm environment so that a classroom feels relaxing, feels manageable, feels like a nice place to spend our time? And then out from that, we think about strengthening our emotional health. How do we build those social emotional skills from a young age, as well as in our adulthood, so that we can recognize our feelings, manage them, and get along well with other people? Then the final ring of the circle is connecting with the community and collaborating so that we're all in this together and we're all supporting the well-being of our children. All of this is within a foundation that is trauma-informed, that is culturally responsive, and that is multi-level, operating at every level of the early childhood system.
One of the ways that we employ a trauma-informed approach is by checking in with people to see how they're doing, really asking that question, how are you, and meaning it, and creating safety for them to answer that question. So we have creative ways of identifying sources of stress that allow people to be anonymous in sharing that information, and using things like polls and other ways of making it more comfortable to say what's hard and to share what your stress level is, and how you're managing and coping with that stress. Everything we do for them, we see as a parallel process for what we will ask them to do for center directors, for teachers, for family childcare home professionals. So we are giving them the experience of feeling seen, heard, and held, of feeling like they matter and they belong first, before we ask them to pass that on to someone else. And we feel really strongly about that in order to be able to pass it on and really understand and get it and value it and be invested in it, you have to know what it feels like. So we want them to have the experience of feeling truly heard, held, and seen, and truly feel like they belong, and then be supported in thinking about, how do I pass that feeling on? And then do the same for the teacher, the director, the family childcare professional, and giving it to them before we ask them to pass it on to families and children and their coworkers and their staff. So that is something we highly recommend to think forward about, of how to give people the gift before you ask people to give someone else the gift.
How do you start with yourself? Identifying really that whole concept of, self-awareness, identifying what is really not working right now. Why do I go from 1 to 10 in 5 seconds? Why don't I not have the strategies for self-regulation? And so just the concept of self-regulation was where we spent a good bit of our time. And you realize that there's this parallel effect. So if I can self-regulate, then I can then model to my children how to self-regulate. So I think that's kind of the difference.
I'd like to share with you our theory of change. If you would, look at it while we talk through it for a minute. We think this is one of the ways that best describes what we do and how we focus our attention for the childcare community. As you can see at the top, we have our definition of what we feel that trauma-informed childcare requires. So we feel that it requires relationship-based, culturally responsive, attuned practices and policies that foster responsive relationships, not only between the childcare providers and children, but between all the adults in the childcare setting, and the adults that support that childcare setting, and the adults that support those adults who support the adults in the childcare setting. So what we think of ourselves as is a coach the coach model that is designed to reduce stress at every level of the early care and education system through training and coaching, designed to support the existing relationships that are in the early care and education system, and use those relationships as a vehicle to promote self-regulation skills among adults and children, as well as protective factors. So what we have found is that shift to focusing on wellness and reducing stress and promoting self-regulation skills for adults and children has been successful in reaching teachers and family childcare homes and increasing their capacity for teaching those skills, for demonstrating those skills during their workday, and for being more trauma-informed, more culturally responsive, and more attuned to the children in their care. In the Edicare project, we work very hard to address the challenges of implicit bias and the lack of cultural humility that exists in the environments that surround childcare setting. We want to take the focus away from what teachers need to do differently for children around implicit bias and culturally responsive care, and think first about, what do we need to do? What do I need to do? How can I be more self-aware and reflect on my own bias and what I can do about that to de-bias myself, and how I can be more committed to cultural humility and diversity-informed practice and cultural responsiveness, and help support people around how to do that, how to talk about things like culture and in ways that are thoughtful and respectful and courageous. One of the models we use is the Iceberg model of culture to help people reflect on what their own culture is, and then ask them to think about how cultural differences impact relationships. So in this iceberg image, we emphasize that there's so much that you don't see below the surface, and that through relationships with people, we can learn about that deep culture that isn't just the surface that you can see.
Before, it was like I was just going through the motions and just doing what I got to do to get out of there. But now I'm more mindful of myself, how I'm feeling, so I can make sure I'm giving the teachers what they need.
I think it helped teachers take a step back and look at their own lives and how their stress and how their self-care was reflecting on their children inside their classroom.
They helped me tremendously. I just thought I was going to lose. I said, I can't do this. This is just not working.
Mm-hmm.
But they gave me that support and they gave me that push that I needed to stay in and complete it.
Mm-hmm.
If I'm not healthy and I'm not well, how can I benefit the children?
Mm-hmm.
And I didn't look at it that way. But now that I have an outlook on it and it's different, it makes me feel better to come in.
Mm-hmm.
And when my kids see me, they can feel it and they are better.
All the teachers, when we started these sessions, they'd come in with the room arrangement plans and all that stuff. We're like, no. It's not about that. We're just going to sit here and talk about you, right? It was a shocker, wasn't it?
It went to a different level as the project really came to light in our entire agency, and we brought members of our management team and leadership team to the table to discuss it. It was eye-opening that no one knew what I was talking about. But at the same time, how quickly everyone was on board and wanted to know more.
So I hope that our story is similar to one of yours, or something that you can learn from and think about how you can affect change at a system level and a program level, and share what you know, whatever level you have worked on in your career. Share what you know with those who don't know what you know, to help build bridges between the systems that support young children, help strengthen relationships across systems and sectors, and strengthen relationships across professionals, so that we're taking a team approach to supporting the child care community and really looking at their needs as adults first, before we ask them to focus on the needs of young children. So thank you. And we hope that you will find ways to use this in your work as well.